and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob, but what do we got here?
We got the famous pharmacist on the internet,
Yes.
Chris.
Hi, guys.
Today, Brad, we're going to talk about how to promote healing with your sciatica, or if you have a herniated disc. Big part of it's going to be the therapy videos that we have provided you, but another tool, obviously, is going to be some medications that you can do, and
Right.
Chris is going to help us with that.
How are you going to treat it? And a therapist, we're not trained in, experts
The
in
pharmacy
at all.
we're like the layperson, talking to each other over the fence. I mean,
Right.
we don't know anything more than...
So it's nice to go back and forth with a pharmacist who really knows what's going on. I think a lot of people aren't aware, Chris, and maybe you can help on that, where people think if they have questions about a drug or a prescription, they think they have to talk to the doctor. I've known you for a long time. I know that if I talk to you, you're going to give me more than enough information on how much to
better
take.
answers.
Right, because you actually look at prescriptions and help the doctor out in case there's a problem. Is that correct?
Yeah, we're going to help. I wouldn't say help the doctor out. I mean, at the end of the day, the doctor makes the decision to
Right.
write the prescription. But yeah, if we notice something in their profile, or is an interaction or a side effect, or just something that might make this whatever their choice is.
Sure.
We're going to call and at least ask their opinion. If hey, do we want to try a different direction just to make sure we can improve quality of life or keep them a little safer?
Right. So you're kind of
We're kind of a safety net.
Safety net, exactly.
Sure. And before we go a little bit further, Brad, let's talk about, if you're new to our channel, please take a second just to subscribe. There's a little button over there. Chris is going to point to it. It's on
Right
the
here.
screen. We upload videos every day, and we provide them on how to stay healthy, fit, pain-free, and once in a while we're bringing an expert. So,
Exactly. So this video, we're talking about sciatica.
Right, sciatica or herniated disc.
Right. And I think sciatica is referring to pain down the leg. It's a general term, but oftentimes, you probably agree, Bob, and we don't have stats on this off the top of our head, but it's oftentimes from a herniated disc. So you got the soft tissue, the herniated disc, that's inflamed. It's physically out of shape. It's bulging, putting pressure onto the nerve, causing that pain down the leg. So as a therapist, we've got a number of videos on how to change that pain, improve it through your posture, through exercises. But we want to find out what can we do and what do doctors do and how do we work together to increase this whole process so you start feeling better with some pharmaceuticals.
Let's talk about over-the-counter first.
Sure.
Chris, what would you recommend if someone comes in and they have sciatica, they maybe haven't even seen a doctor yet, they just want to try something?
Sure.
Yeah, well, oftentimes they do come to us first, so I think,
Sure.
and usually we're going to turn around and tell them to see their doctors
Go
and
see
see
your
a physical
doctor.
therapist, but especially if it's that bad. But I think realistically, things like ibuprofen and Aleve are excellent choices because they are anti-inflammatories. So as long as they don't have any interactions, they aren't allergic to anything, and they don't have any health conditions that would negatively affect them, go-to choices are either going to be ibuprofen or Aleve. And so from that standpoint, or naproxen sodium. So from that standpoint, it will help to reduce the inflammation. So hopefully, if it is truly the bulging disc, which I would have no way of knowing, I just know they hurt and they've got
Sure.
a weird posture and a gait. We're just going to say, well, give this a try. We'd say probably ice it, use the anti-inflammatory like ibuprofen we'll pick on. We'd say 1 to 2 tablets every 4 to 6 hours apart with some food to protect your stomach. Hopefully we're going to get some good relief from that. And if they don't get the relief, then it's going to be, make sure you call your doctor, and they're probably going to say treat and eval to the physical therapist.
So maybe we want to talk about some of the commonly seen medications that people come in quite often when they have sciatica from
a doctor?
From a doctor prescription.
Yeah, what are some common things that you
Yeah,
see?
well,
treatment protocols?
they try?
Kind of across the board, it seems like it's going to be an anti-inflammatory. So either maybe prescription strength ibuprofen. A lot of cases they do naproxen, which is excellent anti-inflammatory, usually coupled with a muscle relaxant to help because there's so much spasming to try and protect the body. And so a lot of times that loosens up and it gives them a degree of comfort.
Sure.
And then the other thing that sometimes they may do in place of an anti-inflammatory is a steroid, which is kind of a more potent version of an anti-inflammatory to help get them through this phase
And
that's
that's
so
usually
acute.
a relatively short period.
Very short burst
with the-
because
right.
that's Pandora's box insofar as drug is and side effects and things like that. So you want to do a short burst, but more importantly, it seems to give a lot of pack for its punch. So hopefully it will reduce the inflammation to give them quicker healing if they
Sure,
can and
right.
get them back moving towards wellness.
And I think from a therapist point of view, we're thinking maybe there's a problem with their seated posture, whatever the issue is. Maybe they're bending wrong at work, causing this problem. You'll want to take these, the pharmaceuticals, ibuprofen, but you really got to get to the root of the problem.
Right.
Look at the biomechanics. Maybe it's
What caused it in the first place?
Exactly. If it's from a mechanical problem, from a posture issue, a bending issue, lifting mechanics, that has to be addressed. Otherwise, you can continue to throw pharmaceuticals at it, and it just kind of masks it.
Because can you talk about what are some of the more common side effects of the prescribed drugs that you just mentioned?
Absolutely. So in the case of like any of the anti-inflammatories across the board, we want to make sure they're not on any blood thinners because that can actually increase their risk for bleeding risks. And then once we find that that's a go, then we're going to look to make sure they don't have any stomach issues, which long-term or even short-term use with the stronger, potent prescription anti-inflammatories, GI bleeds or stomach ulceration can be a factor. So, basically, a lot of times doctors will actually prescribe just a 5 or 10 day supply
Sure.
to test this out. And then if it's something that they tolerate well, boom, they'll stick with it. But if there's any mention of stomach pain or just discomfort, heartburn, which is a common presentation, they're going to be advised to see their doctor right away to make sure
Sure.
they're not creating a new problem, even though we're trying to fix the problem in
So
their
they're
back.
getting a warning sign of some sorts.
Oh yeah, you're definitely, because
Sure.
we're going to tell you to watch for the certain side effects, which would be the upset stomach. In some cases, it can be even some dizziness. But the reflux or the heartburn or the stomach pain are really the things that across the board with anti-inflammatories and steroids, actually, like a Medrol dose pack, those are things that can really rip up the gut. So we want to be careful with that.
The steroids always seem like they really work, but as soon as people come off them, quite often the pain comes roaring back.
Yeah, and that's the thing. I mean, a steroid, it's a quick hitter in a lot of cases. Long term, it's, there's reasons for long-term use, but you don't want people on it for a long period of time.
Right.
Steroids, I always tell patients, they can solve every problem, but they can cause every problem.
Right.
So it's something, and believe me,
good statement.
doctors don't choose that lightly.
Right.
They come up with a reason for it, and they're like, hey, let's see what we can do.
That's what I've seen.
Yeah.
What about the muscle relaxant?
I think the muscle relaxant is a fine tool too. The negative thing with the muscle relaxants, oftentimes they tend to make you tired.
That's
so caution
exactly
with
what I was going to
driving.
mention because that's the symptom I see all the time on people that
Yeah.
are on it.
So that's a tricky one to get around with, because we don't want them driving. So a lot of times we'll advise people to take it home or at night, so
Right.
they can try and avoid that.
Right.
But if they're so
Try to
miserable
help
they can't
them
even
sleep.
move, stay home. Use the
Right.
muscle relaxant, use the pharmaceuticals to at least try and improve quality of life till they can get to a point so they can drive out and see you
And that's
guys.
the issue. A lot of people are on it and they're like, I'm so tired. I'm like, well,
Right.
and so then you have to have somebody drive them in.
And it's a
actually
very
to-
real danger.
Right.
So it's something that you have to focus on. It's something that, it's your reaction time is blunted.
Right.
Period.
So, we got all these options, and, I'm one of those people, I stay away from meds unless I need them, and when there's a time, I think it's appropriate, but I think things are overprescribed. I don't want to insult your
No.
profession or that, but I mean, in the United States, I think pain pills are maybe too much.
Well, I think that especially when you get to the narcotics. I mean,
Narcotics, we have a problem in the United
Yeah.
States, and they're trying to address it very heavily, and there's lots of new changes that are going
Sure.
underway with lots of doctors, and that's not just the doctor's problem, but I think expectations of pain are probably the bigger problem. Is we all want to be pain-free. Nobody likes to be in pain, and so the solution is, well, what do? Well, we prescribe a medication. It's generally speaking a narcotic, and in the United States we use I think it's 99% of all the narcotics in the world. So
Wow. Okay.
and I understand from the doctor's standpoint because we have people come in and they have intractable pain, meaning that it's just nothing seems to help, nothing, it doesn't go away. And what do you do with this person? They come in and they say their pain's at a 9 out of 10, and and they've tried the other things and they're not helping,
Right.
and so then they go to the narcotics.
But I think we got to get back to the sciatica. And
Sure.
Is this going to make it better, though? Are the meds going to make it better?
the
You've been doing some
anti-inflammatory,
research.
I think, could.
I think the anti-inflammatories are going to help to promote healing because you have injury, and
Right.
injury creates inflammation. And
Yeah.
again, we've kind of chatted about inflammation actually maybe being somewhat helpful, but it can also be counterproductive.
Sure.
So if you get that swelling that's impinging on the nerve, shooting down the leg,
Yeah.
you take the anti-inflammatory to
Sure.
try and reduce that to hopefully free up some mobility and
Yeah.
take the pressure off that nerve. So, with you guys correcting the mechanics and the modalities and everything else that you guys work on,
Sure.
hopefully get them from feeling so not so great to back to a functional state of
I think
being.
the other thing is that movement is very important and with back pain and with sciatica, even the right correct movement that is. And if you just lay still in bed, and lay like a log, things are going to get worse.
Sure.
I mean, that's the first thing we try to do, get people walking. And if they can't
Right.
walk, so if the medication allows them to walk, that's going to help them heal.
Sure.
Yeah.
Very much so. And like you say, I think when you put the whole, it's a whole package. It's not just one thing. I don't think
Right.
one aspect's going to solve the
Right.
problem.
Right.
So I really think that the pharmaceuticals definitely have its
Right.
place as a tool in the shed to ultimately help promote healing.
Yeah, absolutely.
Right. So make sure you see your pharmacist or use your products from the pharmacist, as Chris mentioned. See your therapist, and you'll get through it. The sciatica pain can heal. This can help out, make things a little bit faster. So
and make it more comfortable. While
exactly.
It's happening, so.
Anything else,
Thanks again,
gentlemen?
Chris, for coming.
You're welcome. Thanks,
Good
guys.
work.
Thanks.